All right, so it is day 4 after gallbladder surgery. So I had my gallbladder surgery done on Tuesday, and today is Friday, December the 12th, 2019. Or no, December the 12th, December the 6th, 2019. And so after this, I'm not going to do a daily update as far as my gallbladder because it's pretty much going to be the same. Most of the pain and things like that are gone. I don't have any sort of issue. I am still kind of foggy, I've noticed. I'm still very kind of foggy and droggy and all that type of stuff. And I guess the anesthesia just did a good number on me. I think also when you're trying to recuperate from surgery, you just get a little bit more foggy. And it takes some time to get over that. I am noticing I'm out of breath a little bit more. So if I do a lot of stuff, like I went up and down the steps like a couple of times to get some stuff because I'm trying to get back into the groove of working. And so I did that, went downstairs, got some breakfast for sweets, and went back upstairs and came back down again. And I noticed that I was kind of out of breath, labored breathing. And I think, again, it's due to, just everything, the surgery and the anesthesia. I don't have any issues going up and down the steps, no pains, nothing like that. I can now fully stand straight up, no issue. Before, right by the belly button, it was really tender, and I couldn't stand all the way up. All the other spots are totally fine. One of the areas to the left kind of pulls when I laid down. So I've noticed, like, if I lay on my side, that kind of hurts. That is probably a nerve, maybe, because if you push on that nerve, I feel a little slight pain in my back. And I noticed the two kind of going hand in hand, but it's not the gallbladder because it's gone. So I think when people talk about, oh, I still have a pain in my back or my lower back or this, that, and the other, I think it's due because there's like this nerve. Don't ask me the name. I don't know what it's called, but there's a nerve that goes down along the spine, around the gallbladder or near the gallbladder, something like that. It was explained, and I can't remember. But that basically is what sends all of these pain signals whenever you have an attack. And so that is still there. So anytime that's interrupted in terms of surgery and things like that, you're going to have certain pressure points. And this is not the medical way of explaining it, and I'm definitely not a doctor. But that is what causes that irritation. So you press on that, and you're going to have back issues, or at least in my case. So when I lay on my left side, I could kind of feel that. As far as anything else, no problems. I actually ate, let's see, today I ate a cereal bar. Wasn't too bad. No issues with that. My diet's back. Everything is pretty much kind of back to normal. Bodily functions are okay. No fever. So I got out of this pretty well. Again, they're still sitting like this. There's still a little bit of pain, obviously, in my lower belly. But when I say pain, I'm talking not something you would even really notice. I would say more kind of like slight discomfort. You can't even put it on a scale of 1 to 10 because even at a 1 is probably overkill. It's just not that noticeable. My diet is still very light. Generally, it's not just soups and things like that like I did the first day. I was going to do that for a long time, but I'm doing pretty well. My body's handling it pretty well. Had a lot of gas early on, like the day of and the day after, but since then, not a lot of gas. Everything's starting to settle and do fairly well again. I mean, keep in mind, surgery wasn't that long ago. I have been taking some ibuprofen and Tylenol. They tell you to wait 48 hours after surgery to do the ibuprofen. I took Tylenol 48 hours prior to surgery. Excuse me, and that was based on what my doctor told me to do. So every 6 hours I was taking 2 Tylenol. And then after surgery, still the 2 Tylenol along with, I forget how many milligrams of ibuprofen, but it's basically based on what I have, four of those pills. And so today I've actually knocked off one of those ibuprofen. So I take 3 ibuprofens and 2 Tylenol every 6 hours. This is based on what the doctor says until there's no more pain. But I'm going to start lowering those down a little bit. Also, too, keep in mind that even if there's no pain, you also don't want to have a lot of swelling, a lot of irritation and inflammation, all of that. So a lot of times people get off those medicines or they question why I take so many. I mean, the doctors know what they're doing, but there's a lot of inflammation that can happen, a lot of swelling, a lot of other things too. So I'm following what they're saying, but as far as the massive doses for pain, I don't need that. As far as the ibuprofen, I probably get down to just the normal dose that you normally would take within a few days, along with the Tylenol as well. So other than that, no problems, no pains. Got off of the pain, the actual pain medication, the prescription medicine, the narcotic. I'm just not a fan of that type of stuff anyway. I never have been, don't like it. And so as soon as I can get off of that, I was happy. So I took that, obviously, the first day, and well into the second day. Towards the end of the second day, I didn't really need it anymore because the Tylenol was doing totally okay. And then literally a few hours later, I was able to take ibuprofen, and that totally worked. So I have been off the narcotics for 2 days, right? Yeah, 2 days now. So I feel totally fine. Don't have to take the laxatives or anything like that, so that's great. So yeah, overall, not too bad, not too bad. So I think now, here on out, what I'm going to do is try every week to just do an update video talking about kind of how I feel, my range of movement. You know, now one thing that does hurt is if I were to do a stretch, obviously. So if you do one of those full stretches, yeah, I feel that for sure. I don't pick up anything that weighs any type of weight. Noelle actually had to take the trash cans out to the road because I can't do it. So can't pick up the kids, can't do any of that. The dog doesn't weigh anything. I mean, the dog weighs about as much as this remote, so I'm able to pick the dog up without a problem. But anything greater than that, I don't pick up. I don't let the cats lay on my stomach, which they like to do all the time. They can't do that or walk on it. It would just hurt. But other than that, I really don't have any complaints. I've actually healed up quite well. I'm getting my appetite back. Some people will question if you have diarrhea. You know, I really don't think I do. It's hard to tell because I had to take medicine, because of the drugs. So I don't think that I do. I do know it takes a while for your body to readjust and fix everything. So that's a journey. But other than that, I don't have any major concerns, major problems. So my wounds kind of look the same. I'm not going to show you guys, but they kind of look the same. There's nothing going on. Noelle said they're shrinking, which it looks like they are. They're getting smaller. So the two small ones are getting much smaller already, and it's only been, I mean, again, Tuesday I had the surgery, and today's Friday. So those are getting small. There's no tenderness at all. I can touch those, no problem. I had sensitivity there, so there was no nerve damage. Some people had mentioned they have nerve damage. At the bottom area, same thing. No nerve damage. Top area, no nerve damage that I can tell of as of right now. The top one is not as swollen, or the bottom one, not as swollen as it was yesterday when I showed it on video. And then the top one still got a little bit of a pooch, but not as bad. If anything, it might be kind of puffy there, but not a big deal. I mean, I'm not into modeling anyway, so it doesn't matter. Anyhow, that's pretty much it as far as the gallbladder surgery. I understand why people are so nervous and scared about it. I was too. Because there's so much that can go wrong. There's so many things that people tell you. There's a lot of things that folks will tell you to just live with it. The problem with living with a gallbladder is that you could still possibly develop, even if you change your diet, which people say I just changed my diet. That can only work for so long. You know what I mean? Your gallbladder is going to do what it's going to do. I mean, it's not working. And so either it's not working correctly or it is working, but it's got stones that are causing a problem. So if you were to throw a stone, that's a problem. Stones can get lodged down into the pancreas, and that causes a whole different thing. It's just a lot of stuff that you don't want to really mess with. Infections are real. I actually suffered, I think, an infection from my gallbladder with the fevers that last days on end, over 103 degrees, and you feel miserable. So it's not a good thing, to be honest with you. I've noticed since it's out, I feel healthier. You know what I mean? Like I actually feel a lot healthier, um, just overall. So, it's just not good to have in you. There are people who have had ruptures. Their gallbladder is ruptured. That's worse than having the gallbladder surgery. There are people who have had, like I said, the infection. It could even develop and turn into cancer. So, to me, one of the things that I listened to after, my mom had bladder cancer, and the doctor said, I can remove the bladder and I know I can get it all, and then we'll treat you. She didn't do it. And so she died from bladder cancer, which, went into a lot of different things. One of the things that I have promised to myself to do is make sure I get as many screenings and tests as I possibly can that deal with cancer and different things like that. And if the doctor says, hey, you should probably remove this because it's a good idea, then I would listen to your doctor, to be honest with you. Definitely get other opinions by far. Definitely speak to other people and all of that, get advice. But if a doctor tells you to remove something, I would go with that as opposed to saying, well, there's other people that went online and did this and did that. Every person's circumstance is different. Everyone's body is going to react differently. The way you've been eating is going to be different than someone else. I would just err on the side of safety, and it's not something your body technically needs anyway. There are people who argue and say, yeah, your body needs it, and it has it. Sure, but when it doesn't work, there's a chance that it will just sit there and die. There are some people who have gallbladders that are already dead inside of them, and it's turning it's gangrenous, right? So then it's like you definitely have to have surgery immediately. So you don't want to be in a circumstance like that, or going to another country and all of a sudden something happens. So it's just really not worth it. Anyhow, that's pretty much it. I hope you guys enjoyed this video. Make sure you like, share, and subscribe. And until next time, I will see you. Take care.